My patient looked malnourished. She lives with a relative, so it didn't seem right, but it was clear she wasn't eating well.
I tried to talk with my patient privately about his treatment plan, but his son wouldn't leave the room. It became a problem.
I've been her primary care doctor for 20 years, and all of a sudden she wouldn't look at me, and she cries all the time. She's different than she used to be.
I was shocked to see my client with bed sores. He hasn't been hospitalized or sick at all. When I saw bruises on his wrist that he wouldn't describe, I decided I needed to report it.
Mistreatment of older adults is common, underreported, and likely to become more prevalent as the geriatric population continues to increase in size. Because elder abuse can happen anywhere, in homes, nursing facilities, or retirement communities, medical providers are in a unique position to detect it. There are several types of elder abuse and neglect to watch for. Physical or sexual abuse. Medical providers should note any unexplained or poorly explained fractures, bruises, cuts, sores, burns, or other injuries. Vague pain complaints or newly diagnosed, unexplained sexually transmitted infections should be of concern. Neglect. Lack of hygiene, food, or medical aids, as well as unsupervised medical care, a cluttered or filthy home, inadequate facilities like a lack of electricity or working plumbing, or untreated bed sores should be addressed and discussed. Emotional or psychological abuse. A caregiver who restricts access to the elder, is verbally aggressive or demeaning, or is overly controlling about money or relationships may be acting in an abusive manner. Elders with a sudden or uncharacteristic change in behavior, mood, or social contacts may be showing signs of psychological abuse. Financial abuse and exploitation. If the elder can afford an amenity but is not permitted to have it by another person, or if an elder is suddenly providing unusual compensation or legal rights to a caregiver, some form of financial abuse may be taking place. Elders with any symptoms of dementia, mental health problems, or substance use concerns are at an increased risk for abuse or neglect, as are females, elders of more advanced years, and those who live alone. Medical providers should monitor all risk factors for abuse and neglect during contact with older adults. If you are concerned, interview both the patient and the caregiver separately and privately. Each state has different regulations regarding mandated reporting laws, and it is the responsibility of each medical professional to adhere to these. If you are in a mandated reporting capacity, you don't have to prove elder abuse or neglect. Rather, it is your responsibility to report suspected abuse. The agency receiving the report is responsible for investigation and determining whether abuse is happening. While the vast majority of caregivers are loving friends, family members, and professionals, older adults remain particularly vulnerable to abuse or neglect. Medical professionals must be aware of the signs of abuse and need to be ready to respond in a professional, responsible, caring manner. Your patients deserve nothing less.